The clinic will be divided into 3 sections. Under well-person checks, it will offer medical history reviews and healthy lifestyle assessments. Contraception and family planning advice is another of the areas, with testing of sexually transmitted diseases and sexual health advice also on offer. The facility is promoted as young people friendly.
Although we've said that well-person checks will be offered to those aged 16 and over, because that's the appropriate age to screen for health promotion matters, any person who requires contraception or sexual health advice or treatment may access the clinic. So there is no age restriction, and patients may come on their own. They do not need an adult or a parent with them. Any patient under the age of 18 who attends the clinic will have a risk assessment performed, and we will just ask appropriate questions to make sure that they understand the advice that we're giving. We use a very specific framework to assess whether that young person has capacity to consent, and we also make sure that there are no concerns about that young person being exploited or groomed. So we have a very comprehensive risk assessment. The duty of confidentiality owed to anyone aged 13 to 15 is the same as that owed to an adult, and certainly patients can access our service without fear of us telling parents or informing anyone else. The only time that we would inform other people is if we were seriously concerned about the safety or health of that young person or someone that they know, and we would always discuss that with the young person first. But that is an unusual scenario where we are worried that the patient is at the risk of serious harm. For the most part, all consultations will remain confidential.
And confidentiality is an important factor, with a lot of safeguards put in place to ensure this.
We have a well-person unit unique number, whereby patient consultations will be recorded under this unique number, so they will not be recorded under the usual GHA record, and any tests that are sent or results received will be under this unique number as well, so confidentiality and anonymity will be maintained throughout.
Well, previously you said the aim of the clinic was for it to be a welcoming, confidential and non-judgmental service. So how do you aim to do this, especially when we talk of young people? How do you aim to make the clinic as accessible to them as possible?
Our well-person unit will be young people friendly, young people are welcome, we will have posters up reflecting that. We have a clinical nurse specialist in sexual health who will be joining the well-person unit team, a very important member of the team, and they'll be joining our services from the end of November. They will be doing some outreach work in schools and college, and that will be a way also of signposting young people into the unit, and we will also do some events where we will actually show our faces and explain what we do, so that we can break down any barriers that there may be or perceived to be.
GHA officials say the unit will be at the heart of primary care, focusing on promotion and prevention aimed at producing a well community. People can self-refer with more information and advice on 200 07842. This number will be active as from the 8th of October, when the unit will be up and running.